The Amadeo Handtherapie System is an innovative rehabilitation system for patients with motor disorders in the distal upper extremities. Its function is based on the principle of neuroplasticity, the brain's basic ability to reorganize, allowing intact brain areas to take over the tasks of damaged areas, given that the intact areas are accordingly stimulated. The intensive repetitive practice permitted by the Amadeo system makes this stimulation possible, allowing patients to relearn the use of hands and fingers. The Amadeo Handtherapie System can be adjusted to all types of hands, concerning palm breadth as well as hand and arm length. The fingers are fixed to the system with magnetic fingertips. Thereafter, the range of motion for each single finger is defined via software. The Amadeo system provides highly sophisticated therapy methods and assessment modules, which can be used adapted to each patient in all phases of neurorehabilitation. Through a continuous movement of the limp hand, the adequate areas of the motor cortex are stimulated. Thereby, different grasping movements, like pincer grip, wave and single finger movement, are possible. Parameters like velocity and range of motion are adjustable. The patient's own activity is measured by sensors and re-given on the monitor as real-time biofeedback. Patients with beginning finger or hand function can train their individual limit of performance in this module. Stretching and bending movements are initiated by the patient, while the motion program supports and completes such movements. Resistance to movements can be adjusted separately and continuously. If basic motor functions already exist, different methodic forms of therapy can be used to improve remaining sensory and motor deficits. The patient trains actively in a virtual surrounding, with the goal to steer a balloon through an obstacle course. Continuously adjustable levels of difficulty permit not only training on the limit of performance, but also provide a maximum of attention. An audiovisual feedback takes care for additional motivation. This software tool addresses the sensomotor capabilities of single fingers. The patient has to react to an optical or mechanical impulse with a single finger motion. Through a random selection of the finger or a selection chosen by the therapist, impairments can be identified and treated in a targeted way. As a continuation of the motility, this program additionally caters to the development of the cognitive skills. Besides of the activation of single fingers, the patient has to keep the sequence in mind and has to reproduce it accurately. Different assessment programs allow an objective evaluation of the finger or hand function of the patient for the very first time. The force of every single finger is measured separately, in regard of the flexion as well as the extension. Thereby, it is possible to display or picture the force of every single finger, the total grip force, and the progress over the duration of the therapy. With this unique tool of the Amadeo system, the active range of motion of the patient can be measured and evaluated. While the hand is opened at different velocities, the resistance is recorded. This data do not only allow to draw conclusions about the kind of spasticity, but also about their improvements that result from therapy. Information relevant to the therapy is stored in a database allowing a complete documentation. A graphical analysis provides information about the therapy progress, easy to understand for everyone. Continuous and ergonomic simulation of the grasping movement. For all phases of neurorehabilitation, CPM therapy, active therapy, interactive therapy. Assessment of isometric force and range of motion. Integrated biofeedback mode. High flexibility, easy to use for different patients. Adjustment of velocity and force is possible. Amadeo, the first interactive hand therapy system as an intelligent tool for modern therapy.